Hi there, my name's Jo and I'm an oral health promoter for the Community Dental Service for Northern Lincolnshire and Gaul NHS Foundation Trust. This training is going to provide you with an overview for oral health care for adults, particularly those in residential nursing care or those that require extra support with toothbrushing. We have two oral health promoters working on this project. There are three of us all together in the Northern Lincolnshire and Gaul NHS Trust. So there is Pat Malilo, who is based in North Lincolnshire, based in Community Dental in our Ashby Clinic, and myself on the Community Care Project, who is North East Lincolnshire based, and I'm based in Cleethorpes Primary Care Centre. We also have a lady called Tracy Yarborough, who does health promotion, predominantly working on some of our children's services and our other vulnerable adults programme. So your primarily contacts for community care will be myself and Pat Malilo, depending on which area you're from, north or northeast. So please feel free to contact us should you require more support or more information after this training. So the aim of the session is to increase your knowledge of oral health issues and ways that you can assist your client group with their oral health needs. There are some supporting documents that can help you find out more information or are really good go-to guides should you require more clarification or should you want to implement things into your service area. There are really good go-to guides that we recommend you put in as part of your toolkits. So I'm just going to flick out of the presentation and then I can show you them on the internet. So just bear with me while I just change the screens. One of the documents that we're going to look at briefly is Delivering Better Oral Health. It's primarily aimed at dental professionals, but it is a really good go-to guide if you're looking for some dental advice or information. It's a Department of Health, Public Health England document. It's now on its third edition. I'm not going to go into too much detail, but I do think it's worth you spend a little bit of time just having a look at it and to pick out those bits that are relevant for your service and your client group. Really, there is some takeaway snippets that can be really useful. So we'll just flick through to the contents guide. It just provides a summary of the document and its intentions and the guidance for those primary dental care teams. It gives some principles on toothbrushing and increasing fluoride availability in the wider community, not just for individual age groups, but it does give you a highlight of fluoride across the life course. So it's quite interesting just to have a look at what advice should be given and when. And then section 4 is around healthy eating advice and dietary advice around preventing tooth decay, so that's dental caries. And then there's a little bit about the importance of sugar-free medicines, particularly those that are at high risk of caries. If they are on particularly a lot of liquid medications, if they are regular and routine and do contain a lot of sugar, that can impact on somebody's oral health and increase their risks of tooth decay as well. There's a little section providing more information on improving periodontal health and then also smoking and tobacco use and its relation to oral health and the misuse of alcohol in relation to oral health as well, as it is smoking and alcohol are some of the big contributing factors to mouth cancer. It's a little bit about preventing erosion. We don't talk too much about erosion in this training, so if you do want some more information around that enamel wear, so often erosion can be due to high acid in the diet, so a lot of fizzy drinks. If people have got any eating disorders and tend to have high vomiting, then often that can be a contributing factor to erosion, or those patients that are on any radiotherapy or cancer treatments or illnesses that do mean that they do have a lot of prolonged vomiting, then they are at high risk of erosion, which is the tooth wear of the enamel. So it's that destruction of the enamel, that's what erosion is. But again, this document will provide you some more information around that because we're not going to overly discuss it in this presentation, okay? Section 10 is the really useful one. This is around helping people change their behaviour. So it gives you information around motivation and assessing when somebody is ready to change, because we do all know that it's very difficult sometimes when habits and routines are very well established, particularly in the elderly. It's really hard to change those routines. So that section 10 just gives you a little bit more information around the motivations of people and how we can help change their behaviour. It's something, again, which we just don't have time to cover in this presentation today. Okay, so just quickly flick through. It's quite a long document, so I don't want to go in too much detail on it, but just to show you a quick scroll through. It does provide you with an evidence score, so it grades everything from strong evidence to opinions of respected authorities and based on clinical evidence and studies. So it's quite a good guide in the sense that it does provide you with a rationale for why the advice is given, and it does also allow you to be able to look at the evidence base of where that information stems from. So this is the information across the life course, as I was saying, so it splits it into age categories. So it's a really simple, user-friendly document. And you can see in there as well the professional interventions required and the advice that should be given, and also the evidence base as well. So it's split into caries and into periodontal, so you can see the advice that's required. And again, the risk factor control. So it's a really good document to look at if you want some support and information around a certain issue to do with oral health. Just trying to do it quickly. Okay, so it's a good extensive section on toothbrushing and what advice should be given and what age, and a lot of information around fluoride use in toothpastes and the benefits, as well as toothbrushing instruction and other ways that we can increase fluoride, particularly in children. What the document does give, it's really useful, is it does give you a table of all those fluoride toothpaste that are higher in that concentrated level that we want, which is 1,000 to 1,500 parts per million is that optimum range of toothpaste that we want to be using. So it shows you from supermarket brands to well-known branded toothpaste, so it's quite a good list if you're not sure and you can't find the information of how much fluoride's in a toothpaste, then this is a good document to go to as well. Let's quickly flick down. It's a very long document, but it is really useful. There is some advice that's related to dental professionals, but it does just give you an idea. So those that are really high risk of dental caries, a dental professional can prescribe additional fluoride, so a higher supplement. So you can see here that we can get a toothpaste that's up to 5,000 parts per million. This would only be recommended for those aged 16 and over, that high, and there are indications on when that would be prescribed. And again, that would be at the recommendation of a dental professional. This little diagram, we are going to talk a little bit more about tooth decay and the causes and the process in a few moments, but it's just a really good way of giving you more information around how tooth decay occurs and what's going on in the mouth as well. So what happens is, we are going to discuss it in more detail, but just while I've got this document on the slide, so it's all around the pH balance in the mouth, and what happens is we need we have like a neutral level, and we need the mouth to have an equal balance in either side, and if we constantly dipping down into this dangerous level of acid, then we're at higher risk of tooth decay. So it's about creating that balance, and we'll talk about that in more detail later on. But as you can see the difference, if somebody's having a lot of sugar intakes, it does dip them into this unhappy level. So this area here where my cursor is moving across is where when demineralization can occur, and that's the danger zone for people being susceptible to tooth decay. Oh, my computer's gone on the go slow. So there's information around diet, and it gives you all the Eat Well guide in a nice little summary. On the Department of Health website, there is further information around the Eat Well guide and what is recommended for a good dietary intake. But this document does just give you a little overview from an oral health point of view. It also gives you examples of tracking somebody's diet. So if you want to actually look at what could be causing the issues from a point of view that they're eating, it gives you a nice template to use where you can assess the time and what they've been eating to then see if there's a pattern developed. Just flicking through again. So again, in gum disease, which we're going to talk about in more detail in a second. Again, some of this is relatable to dental professionals, but if you have been in a consultation with a patient and a dental practitioner, sometimes it's nice to look back on this document, and it will help you understand some of that information around gum disease that perhaps you need just that bit of extra clarification on once you get back to the workplace or the setting, or to be able to discuss with the client in more detail. There's lots of information in here. This is a bit about oral health and smoking, so it does give you that brief intervention advice, the pathway that we need to go to assess whether somebody is ready to stop smoking, and around a little bit around behaviour change and how we can help somebody know whether they're ready and want to stop smoking. Also provides a little bit of information around accessing other services, and there's some case studies there as well. Again, predominantly aimed at dental professionals, but they are quite useful. And the same for alcohol in a second, just scrolling down. And alcohol and oral health. Trying to get to section 10 for you, just bear with me. This is some more information about tooth wear now and erosion, if you're interested in finding more out about that. And you can see extrinsic and intrinsic cause of acid there, so it does give you some quite good information in one place around the subject if you want it. And so section 10 is helping patients with change to their behaviour, so you can see that a little bit about brief intervention and how we can get a quick snippet of whether somebody's ready to change and wants to change their behaviour. And then there's also some nice little elements about recognising the different motivations for change, whether people are ready, and then the role of the dental team in supporting that change. But here it's a really good information guide. So that's the main reason why I brought you to this document. It's just because there's so much useful information about how we can have those little conversations with clients that can make a big impact if they're ready to change. Okay. And that's delivering better oral health. So please spend a little bit of time just looking through the documentation. It is on its 3rd edition. It's quite extensive, as you can see, it's 100 pages, so not something I'd really recommend printing out, but pop it in your favourites or in a file if you had a shared file for staff groups to look at information, so that it's accessible for everybody to look at if they need it. Something that probably is worth printing off is another document which is highlighted on the slides, and that's just a quick go-to guide. So again, this is derived from Delivering Better Oral Health, and it's just a quick guide to a healthy mouth in adults, and gives you just the basics really, so that really important information on helping somebody improve their oral health and maintain their oral health. So it's looking after your mouth, and then there is a little bit about looking after the gums and smoking as well there, and mouth cancer and how to reduce the risks, and looking after dental implants. It's not something we're going to discuss in this presentation at all, so it's a good idea to go for more information. and also the importance of visiting a dentist. Also on this document, it does give you some useful links, so it directs us to NHS choices and how to find a dentist, and again the Eat Well guide. On the NHS dental information, it also gives us with information, you can see on the bottom link here, information around those people that are entitled to free dental treatment. And often if you're dealing with a client that needs to see a dental professional or be referred into a community dental service, they will need to pay for dental charges unless they're exempt from treatment. So if you're not sure whether they would be covered or not under an exemption certificate, usually it's for people that are on income support or ESA, something like that, then this would be your link to go to see who's entitled to free dental treatment or whether they're entitled to any help with their costs of dental treatment. Okay, so that's a really useful link to go to. And the final website we're just going to look at now, before we go back to the main presentation, is the NICE guidance. You're probably familiar with the NICE website. There is other information around oral health and local authorities if you wanted to search in the box, but the document I'm going to pinpoint you to for the aim of this training is the oral health for adults in care homes. There's lots of guidance, you can download it, but the website is quite interactive and it does give you a good overview of the documentation that's available. It highlights recommendations and then how to put the guidance in practice, and then also a little bit about who is what responsibility and around oral health care assessments and mouth care plans. It provides you with some nice templates and information as well, and a little bit around developing policies and things in the workplace to make sure that it's included. So you can see there's quite a lot to look at. Just quickly go through some of it. So care home policies, just recommendations for the managers to make sure everything's included. So it literally talks you through what you need to be doing to make sure that oral health is included. And then the daily mouth care gives you information on the training that's required for staff. It's a really good go-to guide, definitely, for making sure that you're in the correct guidelines and you're working towards delivering better oral health for residents and people in care homes. Okay. So again, this slide just gives an overview of the responsibilities, and like I've already said, it is everybody's responsibility to ensure that the mouth care needs of adults are assessed on admission to care homes, and that needs to come in at a care staff point of view, that they need the right training and they need to know how to assess somebody's mouth and oral health care needs. It needs to be the service provider's responsibility to ensure that the policies are in place, and we also need it embedded at a higher level from a commissioning point of view, to make sure that these things are just routine in their pathways. So the benefits of a healthy mouth. The mouth is an indicator of general health. An unhealthy mouth can affect a person both physically and mentally. And a healthy mouth doesn't just include the teeth, it also includes the tongue, the palate, the cheeks, the soft tissues. Oral problems can make things a lot harder to eat. They can lead to dehydration and malnutrition. Often if somebody's in a lot of pain or they have infection, it can be quite difficult to chew the foods. If they have dentures but they're ill-fitting, again, that can make issues with eating. It can make things quite difficult, and the mouth can become quite sore and uncomfortable. So there are lots of issues around the mouth that do affect our general health and well-being as well. And again, it promotes confidence in our appearance, in eating and speaking, and it's a big thing. A smile in somebody's mouth it's a big thing to people, to confidence and to how you generally feel. So gum disease has been linked to a variety of problems, including heart attacks, heart disease, strokes, rheumatoid arthritis, diabetes and control, and we'll talk about that a little bit later on. Okay, so to begin with now, we're going to look at the two main dental diseases that we need to be considering, and they are gum problems and tooth decay. So we'll start by looking at the risks of oral health problems. So there are many factors that contribute to an oral health. It's not just something as simple as visiting the dentist. There is a lot that we can be doing at home, and that we should be putting routines in place to ensure that our oral health care is as good as it can be. There are lots of compromising factors for people of why their oral health isn't up to scratch. Some, it can be those hereditary factors, so that routines have not been put in place from a young age, that it was never stressed to be important going through the person's life course, that they were never routinely access services, or it wasn't ingrained in their personal care routines how important mouth care is and toothbrushing. Diets often are different for everybody, so sometimes you find those that are in lower economic status, so if they're unemployed or difficult with work and housing, that their budgets may be lower for food, and that does impact on the healthy eating and what food is available to them. And again, there's lots of other things that are happening in people's lives that may mean that their oral health isn't as good as it can be. So it could be that somebody with learning difficulties has problems with dexterity and not receiving the support that they need. Those people that are alcohol users, drug users or smoke do have higher risk of oral health problems just because of the risks associated with oral health and those recreational activities. So there are lots of contributing factors to why somebody's oral health might not be as good as it could be. It's not as simple as just they're not brushing their teeth. Okay. So this is what healthy and unhealthy looks like. So it's quite evident in the pictures. It's a bit of a extreme scenarios here. So you can see the healthy side. The gums are lovely and pink. They're not bleeding. They're very tight towards the structures of the teeth and the bone there. You can see there's debris free and it's lovely and sparkly in there. Yeah. And they're nice and straight as well. And then from the second picture, it's a bit of an extreme this. So this is sort of a worst case scenario. You can see the puffiness in the gums. The gums are quite red there. There's a lot of decay and issues going on in this mouth. So not only have we got tooth decay, but we've also got gum conditions as well. You can see the gums have started to recede down. They're very puffy. There's a lot of debris on the teeth there, and the gums are quite large, inflamed. There will be bad breath, and there will be some pain and sensitivity as well. So gum disease, again, we've got some extreme pictures here. So this is the very start of gum disease, the top picture. It's something called gingivitis, and there's a nice comparison again with what we would consider as healthy. So with gingivitis, it's quite a common condition. It is caused by lack of toothbrushing predominantly, and plaque is allowed to retain on the teeth, and if it settles towards that gum margin where the teeth and gums meet, it does make the gums become sore, red and inflamed. So as you can see on the picture here, there's that halo in around where the teeth and gums meet. You can see sort of that red area that's quite inflamed and sore. Okay, so it's caused by that build-up of plaque, bacteria on the tooth along the gum margin. So it's that surface between the teeth and the gums, that little crevice there you can see. Okay. So if plaque's not brushed away regularly and effectively, it can build up and irritate the gums, like you can see in the picture, like I've explained. And if it is left untreated, so if teeth aren't brushed better and if improvements aren't made with regular toothbrushing and how the brushing is done, then it can lead to more serious gum problems. Gingivitis is treatable, and healthy gums shouldn't bleed. Bleeding in the body is a sign of, it's a way of our body letting us know that there's something quite not right. And just as we would bleed when we graze our leg, and it's our immune system's way of actually fixing the problem, and it's exactly the same in the mouth. That bleeding is your body's way of telling you or someone else that there is an issue there that needs sorting out. Okay, so it is treatable, it is preventable with regular routines and toothbrushing. Okay, so if it's not left, if it's not treated and it is left to progress, then you can see the pictures here, there's quite a lot of build-up on those back teeth, their lower teeth, and we often, that's one of the places where you do get build-up because we have a salivary gland just underneath our tongue, and there's the saliva that does help the plaque calcify. So often that's where we do get a big build up behind our front teeth and where the salivary glands are. So another place is here at the back teeth as well. And if it's not left, if it is left, sorry, if it's left to progress and once that plaque does calcify, then it can only be removed by a dentist, so that does cause more problems as well. But what we get like a little pocket that forms between the teeth and gums, and then all the debris, plaque and bacteria starts to build up inside that pocket, and it does start causing more gum problems. Okay, so the bottom picture here is sort of where you're getting on your worst case scenario. These teeth have been cleaned up a little bit by a dentist, but you can see the difference from our healthy mouth we had on the previous slide, that the teeth are a lot longer here. You can see root exposure, so the gums have started to shrink back, and the ligaments and bone that would have held the teeth in place have started to be destroyed. And eventually, if this is left to progress over time, it's not something that happens overnight. It's a gradual process that happens over a long, prolonged period of time. So if it is left and left and left, then eventually the teeth can become loose and fall out. So this slide just highlights it quite nicely, how we go from those stages of having healthy gums to the more advanced stages of periodontal disease. So you can see in the pictorial section, as well as in the photographs of teeth, how it progresses. So we go from healthy gums, where they're quite tight and firm and there's no bleeding, to that gingivitis that we've already talked about, where we get that mild inflammation, some bleeding when brushing. We often get the halo around that gum margin, and bad breath is often an early indication of some problems. And if a dentist, you can see on the picture there that there's a little probe around that gum and tooth area, and that's just shows you that the pocket has started to form. Okay, and then in picture 3 we have got some periodontitis, and you can see that the probe goes into the pocket further, and the gums begin to separate away from that tooth surface, and that causes more plaque and debris to allow to penetrate that pocket. Can't get my words out now. Penetrate that pocket into the area between the teeth and the gums. And then the advanced stage is where we get loss of those supporting fibres, and the bones are destroyed, and eventually the teeth will begin to fall out. Okay, so let's just recap on the right hand side of the slide then, that their gingivitis is no bone loss, no mobility, or no loss of tooth attachments. There's no true pocketing or no gum shrinkage or recession. It's completely reversible and preventable with toothbrushing. Periodontitis is when the bone loss occurs, there's loss of supporting attachments and mobility, drifting of teeth may occur, shrinkage in the gums, and this is irreversible, and it's dental intervention that's required. And again, it's something that doesn't happen overnight. People will have progressed through these stages during the life course if their oral health hasn't been maintained. So the second disease that we're going to look at is tooth decay. And again, plaque is a contributing factor towards the cause of tooth decay. So again, one of the ways that we can help improve with our dental diseases is that toothbrushing routine. So it's really important that we do get those toothbrushing routines in place, and that we're brushing in the morning and last thing at night. Okay, so toothache begins by starting in the enamel. So you can see in the pictures here that we have 3 surfaces to the teeth. We've got the enamel, which is the outer white layer, the crown of the tooth, and then we've got the dentine, which is the next layer in the picture. It's the pinky orange layer, and then finally in the centre of the tooth we've got the pulp chamber. And what happens with tooth decay, if left untreated, it can progress from one layer of the tooth to the next. So it gradually hits that pulp chamber, and the pulp becomes inflamed, and eventually we would get pain and abscess, and often the tooth will die off as well. You can see quite nicely in the x-ray up there at the top, the way the dark shadowing on that middle tooth, how it's progressed from layer to layer. So how can we prevent tooth decay then? So it's actually that frequency of sugar eating throughout the day that causes tooth decay. So if you remember when we was on the delivering better oral health document, I showed you that little graph around the pH levels. Well, it takes up to an hour for our saliva to neutralise an acid attack. So what we mean by an acid attack is when somebody has eaten sugar, it dips us into that unsafe level where there is the potential for the enamel to become destroyed from the acid produced. And we need an hour, up to an hour, for our mouth to return back to that safe pH level. Okay, so we do need to be encouraging that snacks are low in sugar, or better still sugar-free, and that our drinks in between meals should be milk, water or tea or coffee without added sugar. Often you find with older people they have a reduced appetite and need some encouragement to eat well. Some find they can't eat large meals, so they would opt for smaller portions or more frequent snacks. So again, if they have got their natural teeth, it's really important that that sugar is minimised. And if they are a frequent eater, that it's as low sugar as possible to minimise the risks of tooth decay. So it's a little bit like tug and war now. We've already talked about the pH level, and this slide just gives a little overview of that process. So it's the dental plaque that is a contributor, and what happens every time we eat something sugary, it mixes with the sugar in the foods that we drink, and it's the bacteria that produces the acid. Okay, so if we can minimise our plaque levels with toothbrushing, that does help contribute as well, because then there will be less plaque and bacteria in the mouth to produce the acids. And once the acid attack has occurred, it attacks the tooth enamel, and that's what causes the dental caries or cavities, and it's known as the acid attack. Okay, so it's the minerals in our saliva and the fluoride from toothpaste, water and other sources that helps the enamel repair itself by replacing the minerals lost during the acid attack. So that's that hour process where it takes up to an hour for the mouth to return back to a safe level, and what's happening during that process is those minerals that have been lost from the tooth during the acid attack are being repaired in a remineralisation process while the mouth is repairing back to a safe pH level. Okay, so they go through this natural process of losing minerals and replacing minerals all day long. So what we need to do is create that balance, so hence the tug of war. It's making sure that we've got the right balance of not dipping too much into that unsafe level, because the mouth and the teeth can't repair the minerals lost, and that's what causes the holes. Okay. So toothbrushing. So while there is evidence to show that powered brushes are effective, it's the action really that's required. So we'll go through toothbrushing techniques in a moment, and I've got some videos hopefully that I can play to show you around toothbrushing. So it's what's more important is the effectiveness of the toothbrushing. So as well as the technique, it's establishing that routine so that the teeth are brushed effectively twice a day. Okay, so we need to be brushing the teeth and the gums, and this should be last thing at night on one other occasion, and like I've said already, it's often in the morning, last thing at night. Okay, but if that's not suitable for a person, if they're not very good in the morning, then on another occasion. But the one that is really important is the last brush on a night time. So what happens when we're sleeping is our pH level drops anyway, and we naturally don't produce as much saliva when we're asleep, so any sugar that's been eaten is left on our teeth overnight, and of course that can cause more damage as well. Okay, so we should be cleaning our teeth for at least 2 minutes, and after brushing we should be spitting out excess toothpaste and not rinsing out. It's really important that the fluoride stays on our teeth. It is an important element as it does prevent and control and arrest tooth decay. Okay, and often as well there are other ingredients in toothpaste that do help limit that plaque build-up. So we want toothpaste that's quite high in fluoride. So in Grimsby there's no fluoride in the water, but there is fluoride in some of Scunthorpe's water, so we do need to make sure that our fluoride level is over 1,000 parts per million. Okay, and you're looking on the ingredient list for ppm. It does tell you on the back how much fluoride is in the toothpaste, and again that Delivering Better Oral Health document does provide you with a list of what toothpastes do have that high level of fluoride in, so refer back to that list as well if you're not sure or can't find it on the paste. Okay. So regarding toothbrushing for plaque removal, it's sometimes we may have to just modify somebody's technique. It may be that they're brushing twice a day, but they're perhaps not brushing as effectively as they could. So it's for a gum disease point of view, it's that mechanical action of removing the plaque that's the important element. Brushing the gums as well as the teeth reduces that inflammatory response of the gingivae, so that inflammation and swelling will go down as well if we're massaging the gums as well as the teeth. And like I've already said, some toothpaste do contain ingredients which reduce that plaque build-up, the gingivitis and bleeding gums as well. Okay. So when we're thinking about toothbrushing, we need to be looking at the brush that we use. So we recommend a small headed toothbrush with medium texture of bristles on the brush. We should be using mouthwash at a separate time to brushing. So what we don't want is that somebody uses a mouthwash straight after brushing their teeth, because that will just wash away that fluoride that they've put on the teeth from the toothpaste. So usually mouthwashes contain a less amount of fluoride than what the toothpaste would, so therefore it's recommended that a mouthwash is used at a separate time to brushing. And we need to be using a systematic approach towards toothbrushing. So what I'm going to do now is show you a video on a model of how we should be brushing our teeth. The toothbrush bristles should be angled at 45 degrees towards where the teeth and gums meet. Starting with the lower teeth, place the brush at the back of the mouth. A circular technique is gentle on the gums and ensures that bristles are working in those areas along the teeth and gum line where plaque collects. Work forward towards the front and then repeat on the other side. Then work in the same method on the inside surfaces of the teeth. This can be easier just by using the tip of the brush. Finally, brush the biting surfaces. Ensure that the brush works along all teeth, particularly at the back. Then repeat exactly the same steps for the top teeth. This time, angling the brush upwards towards the gum line. Again, working methodically to ensure all surfaces are clean. Using a mirror will enable you to see what you are doing. If you are using an electric brush, this will provide the mechanical action. The brush should still be positioned in the same way at a 45-degree angle to the teeth and gums, and then simply move from back to front, remembering to still clean the insides, tops and biting surfaces of the teeth. Any remaining toothpaste left in the mouth should simply be spat out after brushing. Do not rinse. Rinsing the mouth immediately after brushing will wash the fluoride off the teeth, reducing its preventive effect. Remember when brushing to ensure that all teeth and gums are cleaned. Be systematic in your approach. The outside surfaces, the inside surfaces and biting surfaces should all be brushed, as well as the gum line on the top and bottom teeth. When we're brushing for someone else, there's a few things that we need to take into consideration. We do need some good level of cooperation if we want to carry out oral health care and mouth care on another individual, and we do need to make sure that we're happy to proceed. So communication is really important. We need to ask that they're happy for us to proceed, and we need to tell them at all times what we're going to be doing. And it's really important that the person is comfortable, so in a back supported chair if possible, or if they are unable to get out of bed, then use lots of cushions and things to prop them up so they're as sat upright as possible, or use the movement of the bed if that's able as well. We should be standing behind them if we can, or to the side. If that's not possible in a bed, then position yourself so that you're able to carry out the task quite comfortably, because it's important that you're comfortable as well. We need to have a mirror available so that we can show the person what we're doing if need be, and that they can watch and have as much interaction in the process as they possibly can. It's really important that we move any dentures before we start brushing, so these should be taken out. We will carry out some dental cleaning and show you how to clean dentures later on, okay? So make sure the head is supported. So again, use some cushions, or if you are stood behind the person, you can use your body as a support as well. And then, just as we've shown in the toothbrushing demonstration on the previous video, we do follow the same guidance as though we was brushing our own teeth for someone else. So the best thing to do is show you another video on how we would go about doing that process. Okay.
Hi Tracy, I'm Pat and I'm here this afternoon and we're going to do some toothbrushing. Is that okay? Okay, what I'm going to ask you to do is just rest your head on me and ask you to open wide. And when you've got the head resting on you, it's very easy to give you, it's much better, it gives you better vision and better access to the mouth. Okay, are we all right there? What I'm going to do now, I'm going to put some toothpaste on. We're going to use a pea-sized amount. Are you feeling okay, Tracy? Keep your head resting on me, and I'm going to ask you to open wide, and we're going to start by brushing the teeth at the bottom. I'm going to start by brushing these teeth that we chew our food with, the biting surfaces. Gives them a really good scrub. Once we've done that, we're going to angle our brush and we're going to brush round and round and round in circles, working from one side all the way round, and starting and doing the other side, brushing the gums as well as the teeth. This is a better way of removing any plaque and food that I may have got caught in the teeth and around the gums. I'm going to turn our brush long ways. I'm going to brush in the inside where our tongue goes, and again brushing the inside of our teeth and gums, brushing round and round in circles. Okay, all right. Am I okay to continue?
That's fine.
Okay, then I'm going to start on the top teeth. We'll start again by brushing these teeth on the biting surfaces, the teeth that we chew our food with. Okay, giving them a good scrub. Lots of little nooks and crannies where the plaque can grow. I'm going to turn our brush angled again and brush round and round in circles, swapping the toothbrush over and brushing round from one side to the other. Okay, then we need to open wide again. Turn our brush long ways and brush on the inside of our teeth, behind the front teeth. And then angle our toothbrush again, brush round and round in circles on the inside of the teeth, and then the other side. Okay, and then we will ask Tracy if she can spit any excess of the toothpaste out.
So communication is a really important aspect when providing mouth care. Often care staff find it quite difficult to toothbrush for someone else or to clean dentures that are not their own. So always explain what you're going to do and make the person feel at ease and comfortable in the task. Often we have to do these things that are quite difficult when we're looking after someone else. So think about your body language, your posture, your face expression. If you know that it is a task that you don't particularly like doing, make sure that your face isn't telling the person that you're assisting that, because it needs to be a positive process and two-way as well. So active listening, your tone of voice, you can use simple jargon, don't use any medical terms. Make sure your communication is a two-way response and it's appropriate for the person, and build on your communication. You will have already built up a rapport with your resident or with the person that you're caring for. So it's just building on that process, making sure you've got equal understanding about what you're going to do and the task that you're carrying out, and ask questions and ask them for feedback as well on the process. There are lots of different aids and things that we can do to help somebody remain independent when toothbrushing. So electric toothbrushes are really good, as they usually have a bulky handle, and the mechanical action is very good for those people with poor dexterity problems that can't manually manoeuvre the toothbrush themselves very well. A Dr. Barman's brush is a triple-headed brush that cleans all the surfaces at once. They're really easy to use and good for people with limited opening and when there's limited opportunity for cleaning as well. So if cooperation's not great, that kind of thing. And I do have another video which I'll show you how to use them in just a second. We're just going to go through some of the brushing aids and how we can adapt brushes and things to help people remain independent. Okay, so again, the thing with the electric toothbrush, just to reinforce, is it's a really good handle, good size to grip, and because it does that oscillation motion for us, all the resident needs to do is literally place it on their tooth and then move it along from tooth to tooth. Use on a model, probably easier to explain. So it does that circular motion, it needs to be placed along the gum line, and it just gets moved from tooth to tooth. Obviously this size ratio is not right. And then again, they can place it on the biting surfaces of the teeth and the incised teeth as well. Often the brushes do have a timer on them, so it will indicate the 2 minutes, and some of them do like a buzz, like an alert system to let the person know that they need to move on to the next area of the mouth, so they can be quite useful and good for other people if you're brushing someone else's teeth as well. The Dr. Barman's brush, you can see the triple head here. Okay, so, and I'll show you a demonstration video on how to use those. They are quite expensive, they're about £4, and they can be difficult to get hold of, but you can get them from Amazon. Okay. So there's other things we can do to adapt brushes as well if we're looking at dexterity problems and people that have problems with grip. So again, they're similar to items that you would use to adapt cutlery. The ones where you can use the lagging to help people hold and stop them from falling. We have like the insert, so you can pop the brush into, this is just like a pipe lagging, or it's like a bicycle handle grip to enable people to grip the brushes better. These are small interdental brushes so that people, if they've got large gaps between the teeth and things, they can move those bristles around those difficult areas to clean. We can also heat a toothbrush up to bend it so that it can, if you pop it in hot water, you will find that the plastic becomes mouldable, so you can actually bend the toothbrush. If somebody does have that difficulty in getting the brush into the right position, you can bend it and help them to get a better position on the brush. Okay. These are custom made in a dental practice, and you can buy the putty again online. It's just the lab putty, so it's 2 elements that are mixed together that then set. And the great thing with these is you can provide a personal grip so that it is exactly fits to somebody's hand on how they would hold the brush. Okay, and if you put Vaseline on the brush, they will come out, or this one it would be stuck in. So you can pop cling film around the brush before you do them Vaseline on the brush, and then you would be able to slip the brush in and out to replace it with another brush when this needs replacing. Okay. Another really good one is the use of a band. So what you do is you pop the toothbrush in the hand, and the band, if you can see, has gone around the head of the brush, and then it stops them from dropping the brush. Okay. So another thing we can think about is if we need to hold somebody's mouth open, or if we need to help them hold their own mouth open. So there's the different props, and there's also some finger guards which I've got on the slide, which I haven't got to show you unfortunately. So this is aimed for someone to bite on. They are bonded, so there's no way this comes off, and again you can use it this way or that way if necessary, and you can also use them in the mouth to just hold the soft tissues out the way. And often something as really simple as a big spoon. This is a really chunky plastic picnic spoon, and they're soft around the edges, they won't do any damage, and they're often really good for helping you just manoeuvre the soft tissue out the way to help you get to the areas that you need to clean. Okay, particularly if somebody's got not a full dentition but only partial teeth and access is quite difficult. If you pop this in, excuse my fingers, it allows you to open those soft tissues up so that you can clean around the teeth really nicely. Okay. So as you can see now that we're back on the slides, there's some other examples in the picture. So the pipe lag that we demonstrated. There's also, if you can see in the top picture, there's one of the brushes has a flexible head as well, so that can often help when there's difficulty with pressure and dexterity problems. There's the one where a large elastic band's just been wrapped around the handle to give it that extra grip. And you can see here some examples of more finger guards and mouth props that I was showing you. So the baby brush are often quite good as finger guards. They will help protect you from getting bitten. And the blue, like witch's hat, that is another finger guard and mouth prop in one. So they are available on the internet and from a company called Denture Care, and they can either be used sideways or long ways to give you more or less mouth opening, and the bonus is that they do protect your finger at the same time, so it's one thing does two jobs. And again, the little white peg looking things are other bite blocks that are available. Okay. So again, we've just got more photos of possible examples. So you can see the band example here, the tennis ball, and the pre-made grip from the dental practice, the bicycle handles. There's some examples of the bent toothbrushes there, and using grips. So there's a Velcro strap, which is often used on cutlery. You can see the hair roller example, the foam padding. And you can see as well in the picture with the lady how the witch's hat type mouth prop is designed to be used. And also there's things like the washing up sponge with elastic bands around. So there's lots of ways that we can try to adapt a toothbrush to help with a person's independence. And again, from an oral health promotion point of view, that we're more than happy to provide some advice and suggestions and things if you've got a particular client that's struggling. Okay. So what I just want to do quickly is show you the demonstration of how effective the Dr. Barman's brush can be. It is a really useful piece of kit for people that have problems with dexterity, or if you have limited windows of opportunity for brushing for someone else. So they do all the surfaces in one go, and they're also really good for people with learning difficulties or any special needs that do require that extra support with the brushing but want to remain independent, or again if your window of opportunity is limited. So I'm just going to play that video for you now.
This video will demonstrate how a double-headed Dr. Barman's brush should be used. The brush should be placed at the back of the mouth, starting on the last tooth. Let's start with the top teeth. As you can see, the brush is designed to clean all surfaces of the tooth and gum line at once. It works the same on all teeth. Slight pressure may be needed to ensure the brush reaches the gum line. The brushes also come in different sizes. Choose the most appropriate size. The brush should be moved back and forth, ensuring it works over all the teeth, bringing it forward towards the front of the mouth. Once at the front, take it to the other side and repeat on the other side, bringing it forward again to the front of the mouth. This should then be repeated on the lower teeth.
As well as looking after natural teeth, we also need to look after dentures as well. So if somebody does have a partial denture, it's important that their teeth are not cleaned with the denture in. They should be done separately. So we should be cleaning their natural teeth first, and then the denture should be cleaned out of the mouth. The video that I'm going to show you now gives you an overview of how to clean a denture, and as you can see on the slides are the steps that we need to be taking when cleaning and caring for dentures.
This is a simple demonstration on how to keep a denture clean. Just like natural teeth, dentures harbour bits of food and deposits of dental plaque. Firstly, it's important to clean the dentures over a sink or a bowl of cold water. This prevents breakage if a denture is accidentally dropped. Make sure all the surfaces are cleaned. The same applies to chrome or metal dentures. Ideally, they should be brushed at least twice a day. Once you have finished brushing, rinse them under cold water. When dentures are not being worn, they should be kept in a small container and submerged in water. This will prevent shrinkage. I am using liquid soap rather than toothpaste, which can scratch the acrylic of the denture. If you are using a denture brush, use the smaller side. This will help enable better access and will clean the intricate areas. Again, clean all the areas as I did with the top set. I am treating these teeth exactly as I would my own natural teeth. Again, give them a rinse and pop them into a container. If preferable, dentures can be soaked in shop-bought solutions. Ideally, dentures should be left out of the mouth for at least 6 hours in every 24.
Teeth, and there could be other associated factors to consider as to why a person is struggling to maintain their oral health. So we did discuss those lifestyle factors at the beginning of this training, but it could be that the person's had good oral hygiene in the past and this has declined in quality over time and now causes a concern. The list on this slide just gives a few possible reasons as to why a person may be struggling to manage their own oral health. So it could be things such as a death of a spouse and changes in motivation, and now cooking for one as opposed to cooking for a couple or a family. There could be a reduction in physical activity and mobility and those issues around dexterity. There could be failing health or problems with eyesight or other senses. It could be a sudden onset of illness or bouts in and out of hospital. It could be xerostomia, which is a dry mouth condition which we'll talk about in more detail later on. That deterioration in smell and taste, so again, like I've already said with the senses, it could be issues around loss of appetite and the lack of interest in wanting to eat and do toothbrushing, oral hygiene and things just because the mouth is dry or feels different. That physical ability, so the problems with cooking, shopping, again, that dexterity, not having the same physical actions or movements as they did when they were younger. It could be down to a decline in poverty, so no longer working and income not being as great as before retirement, that kind of thing. Could be discomfort from ill-fitting dentures, so there is important to make sure that they do fit and they are doing the job they should be doing, which is to enable people to eat as well as promote that confidence. So dentures are made in a way that they give a lot of structure in the face, so if they are ill-fitting, often you'll get their face shrunken in and things, and those changes in appearance can really affect somebody's confidence levels. And again, it's the lack of information and up-to-date on information on health and nutrition, so that information around the Eat Well guide, making sure that people are aware of what constitutes a healthy diet and how they can better look after themselves. And often in older people, particularly those that are in residential care or are in vulnerable circumstances that have got a lot of family, often it's knowing what to buy them as gifts when they're older. So they do sometimes receive larger amounts of confectionery as gifts. So again, it's just being able to manage that. And we don't want people not to enjoy the pleasures in life. It's just that frequency of sugar, like we've already said, that does cause tooth decay. So try and keep the sweet fixes to meal times or limit the amounts of day that they're being eaten. Or again, have parties in the care home, share them with other residents, that kind of thing. So if they're getting a massive amount of confectionery, then it's just that creating that balance. Okay. And it's old habits, like we've already said as well, that they are difficult to change, so such as having a lot of sugar in tea or coffee, that kind of thing. They're often things that it's difficult to change, so what can we change instead to help improve? So often that's about the plaque, so if we can up the toothbrushing, you can compensate. It's not necessarily the best advice to give, in the sense of sometimes we can only do better and to achieve a minimal intake in sugar, as opposed to saying no, you can't have that, let's just try and limit the amount if we can, or make improvements elsewhere if habits can't be changed. Okay, So often problems that older people face with oral health, and often there are common problems in older people that do relate to the mouth. So things like what I've talked about already, the dry mouth and fungal infections around people that wear dentures, or if the dentures are ill-fitting, often this can cause denture stomatis, which is where people get inflammation of the soft tissues. They can be sore patches, and as we said in the video, it's really important that the dentures are removed from the mouth as well, to give the mouth and soft tissues time to breathe and have that supply of oxygen that they're not getting with the dentures being worn 24/7. Angular cheilitis is the cracks at the edge of the mouth, so often it appears here at the side. So again, with ill-fitting dentures, if their mouth's overclosed, it causes those extra creases in the soft tissues around the lips, and if not cleaned regularly, that can develop into a fungal infection. It can be quite sore. So those that are having problems with periodontal diseases, it can be more susceptible to root caries if those roots are exposed. If you remember back to the slides where the teeth were quite long, those, once the root's exposed, once the dentine's exposed, they are more susceptible to decay, as the surface there is not as strong as the enamel. So again, those people that have confectionery gifts, a lot of sweets and sugar, treats in tea and coffee, that kind of thing, it's trying to minimise that if they do have a lot of root exposure, and using sensitive toothpaste, that kind of thing, to help. So again, sensitivity due to the recession is quite common, and thrush as well is quite common in older people, particularly those that do wear dentures. Oral cancer is a big risk for older people, particularly those that smoke and use a lot of alcohol consumption, and often we can get trauma. So with older people, the soft tissues become more fragile with age, so just as skin does, when knocked and banged, they're more prone to trauma and damage. And often as well, it's that thermal aspect, so making sure drinks are not too hot because they're more susceptible to burns. Okay, so possible barriers to receiving dental treatment would be that decreased mobility, the being dependent on someone else for travel, or due to medical conditions, not being able to access services as easily as they used to, and memory loss as well is a big factor. So early onset of dementia, those kind of things, just people forgetting appointments, forgetting to attend. Often services don't have that understanding of the client or the patient from a dental point of view. So unless the dental professional is told that they're forgetting the appointments because of a medical reason, it's quite easy that they could then not be seen as a regular tender. So it's really important to provide support and things with appointments if there is some memory loss. Okay, and the times of appointments as well. So are people better in the morning? Do they prefer to have appointments later on in the afternoon? It's trying to ensure that services adapt to patients' needs and clients' needs to make sure that we can see them at optimum times that are suitable for them, so that they can still access care at times that's appropriate and suitable. And then wheelchair access is often difficult. Some of the dental practice, particularly in our area, are in older buildings and houses, so it's ensuring that they can still access services. So we would recommend that if a patient or client is with an existing practitioner, they stay with that dentist if they are able, and if they have seen that dentist regularly in the past, there's no reason why they can't continue to do so just because they are now in residential or nursing care setting. If access is an issue for that dental provider, then they can refer them into the community dental service. And if they don't have a regular dentist, there would be no reason for them to not access general dental services if they can. It would only be a referral into a specialist service if there was a reason that they couldn't access. So there is some criteria for community dental service on the hospital website. So it's worth looking at that if you feel like you need to refer somebody in. Okay. So those that are medically compromised as well do often have a higher risk of oral complications. So for example, those with diabetes often had gum problems due to the blood vessel degeneration and altered collagen metabolism, affecting the repair and maintenance of the body tissues, and they have difficulty fighting infections. So those that do have gum problems, it's often more difficult for them to rectify. It could take a little bit longer, and it's really important, because they're diabetic, that they do keep on top of their oral health because of this. For epilepsy, often they can see a growth in the gingival margins. They become quite puffy and swollen, and this is due to, it's a side effect often with some of the anticonvulsant drugs, so it can be looked like it's a manifestation of a gingival problem, but sometimes it is that it's the side effect of medication, unfortunately. So again, it's making sure that the mouth's kept really clean and on top of, because there's the more potential for the pocketing because of the swelling in the gums. And things like AIDS, the gingivitis is often severe with ulceration, thrush, and the HPV virus as well. So it's just, it can often lead to more complications with gum problems. And rheumatoid arthritis, it's more difficulty with the jaw and pain in opening the mouth, dexterity problems, so may have more difficulty cleaning their own teeth. Those with Crohn's disease or colitis or digestive problems sometimes present with oral manifestations in the mouth. They can have gingivitis or severe ulceration despite their having good oral hygiene. And lichen planus is something that you might come across. It can also be known as geographic tongue, and it's a systemic skin condition that also affects the mouth. So it basically looks like white patches on the tongue. Usually, if somebody has got it, they are quite aware of what it is, but often it's just worth getting checked out. If there's anything on the soft tissues that you don't feel looks quite right, always ask a dental professional or GP to have a look at it. Okay. Dry mouth can be something that's quite common in older people. It's that reduction in saliva flow that does cause a dry mouth, and it can be caused by medication. Often the more medication you take, the more likely you are to suffer from a dry mouth. Some examples are antihistamines, antidepressants, beta blockers, antihypersensitives, diuretics can also contribute to dry mouth. Sjögren's syndrome is a condition where the body's immune system malfunctions and attacks the body's own tear and salivary glands. And with diabetics, it can cause increased urination or an underlying metabolic or hormonal problem, which also can result into a dry mouth. With those patients that have had head and neck cancer and its treatment, it's marked as one of the most distressing symptoms of treatment, radiotherapy affecting the salivary glands and causing near total reduction in saliva flow. Many never do regain their full flow after treatment. Other causes could be anxiety, acute illness, breathing through the mouth, and salivary calculi, which is a build-up of calculus, similar to what we get on our teeth but in the salivary glands, and gland removal, and even the menopause. So dealing with the dry mouth, it's really important that we have a diet high in fresh fruit and vegetables, because this does stimulate the saliva flow. We need to avoid foods in high sugar. This is mainly as well because of that risk to caries. The saliva in the mouth does help naturally clean the teeth. So if it isn't present, then we do need to make sure that our diet is low in sugar. We can use sugar-free gums to stimulate saliva. Often older people might not feel comfortable with chewing gum. It can be seen as quite an ill-mannered habit sometimes, and often it's difficult for denture wearers to chew chewing gum as well. It does tend to get stuck, particularly if they are ill-fitting. Frequent sips of water or sucking on ice chips, and we can lubricate the mouth with natural oils, sesame seed oil, olive oil, even coconut oil. There are prescription drugs available to help stimulate saliva flow, and also saliva substitutes that are available over the counter. We should be cleaning our teeth twice a day with a mild SLS-free toothpaste that's got fluoride in it, which we'll talk about those in a second. And we can use mouthwashes as well. There are mouthwashes particularly designed for people with dry mouth. If we're using just a regular mouthwash, then it needs to be alcohol-free, and it should be done at a time of day after brushing. So around meal times is a good time, because it does help remove any food particles that have been remained in the mouth. You do sometimes find people with a really dry mouth retain quite a lot of food after they've eaten. So we can also get rapid moisturising gels or sprays, and these can also be applied during the day and at night, and can even be applied underneath dentures just to make them more comfortable to wear. So the non-foaming toothpaste, this is the SLS-free toothpaste. It's the foaming ingredient is called sodium lauryl sulfate, that's the most popular one, or the sodium methylcoccyl chordrate. Non-foaming toothpaste that you can usually buy over the counter. The most popular one is Sensodyne Pro Enamel, but there's also a toothpaste called Aura Nurse, which is flavourless as well. So you can buy it from Amazon. They do sell it in some supermarkets, and it's really good because it doesn't foam up, but also it has no mint or no flavour, so it's really good for those individuals that have sensory problems or any learning difficulties that can't manage the mint taste, that kind of thing, and it is still high in fluoride, so that's really good. And then there are the bio products, which the Biotine and the Bio Extra, which are designed for dry mouths as well. So often when people have difficulty swallowing or are nil by mouth, if they're peg fed or if they're bed bound as well, it's really important that their mouth care is still carried out, as a neglected mouth does cause bad breath and also discomfort as well. So we'll get that build-up of plaque if they have got existing teeth. But even those that don't have teeth, it's really important that we do remove some of the bacteria in the mouth. So we should be using the swabs and things to just help clean the mouth. It should still get daily mouth care. Brushing stimulates the mouth and reduces hypersensitivity. Dental erosion is often common for those people with teeth due to acid reflux, and that reduced saliva flow as well. Dental plaque does contain many different species of bacteria, and some of which can cause pneumonia. So it's the aspiration, the inhalation of the oropharyngeal secretions. So that does include dental plaque as well, and they've been found to be associated with the risks of pneumonia. Okay, so patients lying in bed and older patients with decreasing levels of consciousness are more likely to aspirate the oral secretions. So assessments need to be made to make sure that they get the right care that they need for their mouth care. So with regard to carrying out mouth care assessments, there is a lot of information on the internet, and particularly on the NICE guidance around carrying out mouth assessments, and also the policies that need to go with this to support it. So it's really important that on admission it is included in that initial assessment of a client to make sure that we know whether the client has a dentist, who this is, and when their last appointment was if possible. And also we need to ascertain whether they're still able to access that service. So if there is no reason why they can't still access a general dentist, this should still happen and they should still access as the dentist recommends. So this is usually every 6 months. If there has been no contact or they do not have a dentist, then it is important to help them find one, particularly if they have got some oral health problems as well. So if there is any reason they fit the criteria for the community dental service, this shouldn't be the first port of call. Assessments need to be made as well as to whether they fit the criteria and why they cannot access routine dental services. And then all the referral information can be found on the Northern Lincolnshire and Goole Hospital website under the community dental service. So that gives you the referral forms and also the information of who fits the criteria. So we need to also look at how the resident or client would usually manage their own daily mouth care. So what type of toothbrush they have, what type of toothpaste they use, are they still able to carry out their own mouth care? And this should be then charted that it's done and prompted every day. You need to check whether they need support and what that is. So whether it's just some adaptations to the toothbrushes like we've already discussed, or whether it's purely that they need somebody to clean their teeth for them. Those assessments need to be made when they come into the care home, or when they come into the setting, or when you begin to carry out mouth assessments if it's not something you've done in the past. We need to also check whether they have their own teeth or whether they wear dentures, and this includes any partial dentures as well, and whether they have their name on or not. So if they are unmarked, you can have networks with local laboratories, and it is at a cost unfortunately, but they can mark up dentures for you to make sure they have got names on. But it's also worth asking a dental practitioner, if they are going to make a new set of dentures for a client, that they do mark them and put their name on, because it is possible to do that when they're being made. Okay. And we also need to attain whether the client is actually experiencing any dental pain or any problems at the moment on admission, and that can be sorted out then, whether it's a visit to their own dentist or whether a referral needs to be made into another service. Down the side of this presentation you can see there's lots of little documents, and what I've done is I have put as much information as I can around mouthcare assessments on this presentation slide. So when we would normally deliver this in a classroom setting, people would get the slides afterwards, and so there's much information on there as possible. And again, there's the Delivering Better Oral Health embedded, and also the links to the NICE guidance and YouTube videos. So please contact me by email if you would like the slides post completing this training, because then you will have those links to the information. Okay, I'm just going to show you a couple of the assessments now and some information that we use that you may find helpful. So again, if you'd like to have this information afterwards, then please do contact me. Okay. So first of all, I'd just like to show you a toolkit that we've produced. They're designed to act as a guide for care staff to be able to triage some small problems around gum disease. This might be easier if I zoom in a little bit so you can see the process. So we're looking first of all, if they have said they've got a problem, does the person have their natural teeth? And then we go down the flow chart. So yes, are they able to brush twice a day? And then if it's yes or no, have they got a toothbrush? Is it in poor condition? Does it need changed regularly? If it's no, then do they need assistance with their brushing? And then a little bit of information about concentrating on the gum margins, not being put off by bleeding gums, that kind of thing. And then if they haven't got their own teeth, do they have dentures? Are they in good condition? Do they not have any dentures? If so, try and find out the reasons why they don't have any. Often it's worth asking family members as well if the client doesn't understand or know why they don't have their dentures. And if they do have their dentures and natural teeth, then it's following that guidance as well. So it's just a quick, easy go-to guide to help the staff member go through that process of carrying out a mouthcare assessment and finding some of that basic information. Okay. The next thing I'm just going to show you quickly is this one from the Royal College of Nursing. It's more designed around mouthcare at end of life, so it's just assessing the mouth. It's really nice pictorial poster. It's quite good to put up either in staff areas or in areas where you collate information, and it's quite nicely done in the sense it says mouth care, and then we must assess the mouth and monitor any reported problems, observe the oral cavity and take an oral history, look for any ulcers or oral lesions that are uncomfortable and may cause pain, treat any thrush or other oral problems, hydration, so it's really important to have frequent slips of fluid. Can they brush their own teeth or do they need assistance? Assess and support from speech and language therapy if necessary, and dentistry, and if you require advice and guidance regarding oral health care, and then reassess regularly to maintain comfort, particularly at end of life, and educate and explain and encourage the carer to be involved in mouth care. So it's a really nice, simple poster just to reinforce to yourselves, to staff, that it gives those prompts. Okay. This one is one that we derived for those that are coming into the care setting for the first time. So it provides those questions that we've talked about around: does the person have their natural teeth, who their dentist is, do they have the right materials to clean their teeth, what kind of dentures they have, how old are they, have they got the right materials to clean the dentures and the teeth, if they have any problems at the moment, and then when their last checkup was, who their dentist is, and then whether they're exempt from dental charges as well. And it does leave a section to just put some information in there, so that then when you are carrying out the care assessments and creating a care plan, all health can be included. You can just write a summary and the review date as well as when it's going to be reassessed. It's a really nice, simple one to use. So this one's quite a nice one. It's an oral health assessment tool. It goes a little bit more in depth, and then you're looking at any changes, whether something's healthy or unhealthy, and it just goes through a more complex assessment. So it's more looking at the mouth now, still around dentures. It asks about tongue and saliva and soft tissue as well. A score is then determined, and that will ascertain the level of mouth care that they require. This one is, if you Google mouth care assessment, this one does come up quite popular, and there's supporting information to go with it. I think it is on Public Health England's site as well, with the nice guidance. This one is much more complex, and we do use a similar system in the hospital for those patients that are high risk for aspiration pneumonia and for complications with mouth care. If I can zoom in on this one again. As you can see, it uses that RAG rating of the low risk, medium risk and high risk. And then it does give you a check sheet at the bottom to make sure that it's constantly assessed. It's quite nice. It looks quite comprehensive, but it does provide a lot of the information that's required for a full mouth care assessment. This is from a website, Mouth Care Matters. So if you Google the programme Mouth Care Matters, there is a lot of support and information around the mouth care assessments and how to carry out the record. And they do have a Twitter feed and social media as well. So there's quite a lot of information available for staff on Mouth Care Matters. It is part of a national programme. So the timing of regular follow-up mouth care assessments can be agreed with the client, resident or the family during the initial assessments, as this will vary depending on need. So it may be that some people don't need support on admission, but this may change. So it should be monitored, so support can be offered and care assessments can be altered if there are requirements and things change. Staff in care and residential homes can carry out mouth care assessments. However, full oral health care assessments should be carried out by dental professionals. So we're not asking you to carry out a dental checkup. It's just about assessing the current condition of somebody's mouth. It's purely a visual inspection. You can use the toothbrush or the mouth prop aids, the spoon, that kind of thing, to just have a little look under the soft tissues, pull the cheeks out the way to see if there's any ulcers or any issues and problems, see what condition the teeth are in, that kind of thing. Particularly if somebody does have communication difficulties and can't tell you if there's any problems, sometimes you do just need to have a look before we contact a dental professional. But it shouldn't be a full mouth examination checkup. It should just be a quick look to see if we can see anything going on. Okay. So when we're thinking about mouth care and making those assessments, particularly for those that are at high risk, we need to look at the guidance available and then determine what policies we're going to be putting in place in the setting, and then develop that routine of what care we're going to provide depending on the level of risk. So just an example, and use Mouth Care Matters as some of your guidance and that nice guidance that's available. There's some really useful information on there that will help you set out these plans and policies. So for example, with standard mouth care, we'll be looking at 12 hourly, and we should be brushing teeth twice a day using a toothbrush and fluoride toothpaste. We want to be using a small headed toothbrush with a non-foaming gel if necessary. Okay, and then dentures should be removed and cleaned with the appropriate dental product or soap and water, as we've outlined in the video that we've shown previously in the training. They need to be rinsed well before refitting into the mouth, and they should be washed in an area that's not classed as a clinical hand washing sink. Okay, so also think back to those supervising the brushing and brushing for someone else, so just that extra care that might be needed to remain independent, or do we need to completely brush for someone else? So there's those considerations to take into place as well. And then the next step would be the standard mouth care plus, which would be a 4-hourly regime. So ensuring that the patient is in an upright position during mouth care, carry out that toothbrushing as required, and then encourage fluid intake if appropriate, and consider the use of the oral gels and remedies if they have got a dry mouth. We can provide extra mouth care after every meal, so making sure we clear any food debris using a mouthwash solution. And we can also use the foam sticks or a toothbrush as well. So we do recommend the sage sticks or a stick that is bonded. So if you can see it in the camera, these green ones, the head does not come off, it's a bonded stick, whereas the pink oral sponges, they can have a risk to be bitten and then come off their stick, so just be aware that it is a bonded sponge that we're using. Okay, and then we also have the suction sponges available, so if somebody does have problem with secretions and can't swallow, or they're at risk of the aspiration, then you can attach the sponge sticks. So Sage also carry out this one, which attaches to the suction system. Okay. So that advanced mouth care, we want to be brushing teeth every 3 to 4 hours, and we should be referring to the speech and language therapy team if there are any swallowing difficulties. Always check with the district nurse or medical professional or GP if you're not sure about referral processes. Okay, so we should be checking dentures, that they're not ill-fitting and there's no infections present in the mouth. And we, like we said, we may benefit from that regular oral suction to make sure the mouth's nice, clean and healthy. And we also have products available such as the suction toothbrushes. You can see this one in the camera, it does have the bonded sponge as well as a toothbrush. They are designed for single use and they attach to the suction system, so there's no risk of their swallowing if people have difficulties with swallowing. They do need suction in the room on that one. Okay. So we need to consider the gels and sprays again if they have a dry mouth, and again contact the GP or another health professional if you're unsure about over-the-counter remedies. Something is available on prescription maybe if it needs that extra support or intervention regarding dry mouths. And then we can also use the mouthwashes and things, and some gels and remedies if there is any pain that can reduce pain and infection, but again it's being aware of those risks regarding the swallowing and things. And then if mouths and lips are quite dry, and then as frequent sips of water, follow the advice given for dry mouth. And then we can also use a lip balm if necessary if the lips are really dry and those patients aren't on oxygen therapy. Okay. So finally, it's really important that your client group does still visit the dentist regularly. Even those that don't have any teeth and have full dentures should still have a yearly check with the dentist. That's just to check the soft tissues and the lining of the mouth and everything to make sure that it's healthy. So the dentist will suggest the recall time depending on that risk to the patient and what teeth they have remaining, that kind of thing. So it's really important if they can access a general dentist that they do so, and if not, then we would recommend a community dental referral. And like I've already said, all the information is available on Northern Lincolnshire and Goole Hospital Trust website on the Community Dental Service tab around the referral guidance criteria, and all the forms are available. So if you do require any more information or want any support with anything, or like I've said previously, a copy of the slides, then please contact on the emails on the beginning slides. I'll just pop them up again. So it would be myself if it's a North East Lincolnshire setting, and it would be Pat Malilo if it's a North Lincolnshire setting. So please feel free to contact us. And we'd also really appreciate if you would reply with some feedback on the training. That would be lovely. Thank you.